Welcome to the UN World Data Forum. My name is Emily Corey Pryor. I'm the Executive Director of Data 2X, and I'm honored to be the speaker and the moderator for this wonderful panel. I know that we all wish we were together in person, but alas, we are not. And despite that, I think we can all agree that the World Data Forum organizers have done a tremendous job curating some terrific and extremely timely conversations. And they deserve a huge thank you for their tireless efforts in making this virtual effort happen. So I want to thank them right from the beginning. I'm coming to you from Nashville, Tennessee in the United States, where the moon is still out, but very happy to be having this conversation. And I'm joined today by speakers from across North America, from Europe, and from Africa. And we, of course, have attendees listening in from across the globe, which is making this truly a World Data Forum. Regardless of where you're joining from, we're all experiencing a prolonged emergency in light of the coronavirus pandemic. And in an emergency, we're called upon our expertise, our talents, and our ability to engage in the most human of enterprises, cooperation. And data is critical for cooperation and action. We need data to understand and respond to the pandemic. Data can help us understand who is being impacted and how. And data can inform our recovery efforts that must meet the needs of all populations. And here, unfortunately, sometimes data does not exist to tell the full story. When I'm not moderating panels, I lead Data 2X, which is a gender data alliance that's committed to a future where gender data guides smart policymaking for greater gender equality. We work to ensure that first, gender data is integrated into all data systems, and second, that we as a community focus not only on all of the cool, innovative ways that we can produce data, but also on how that data can be used to improve lives. At Data 2X, we're especially interested in how women and girls are directly and indirectly affected by COVID-19, because we know that this pandemic is not blind to gender, race, ethnicity, and many other intersecting identities. For example, we know that women are disproportionately on the front lines of this pandemic as health workers, as caregivers, as teachers, and more. And yet we don't know enough about how the pandemic has affected their lives because of gender data gaps. Through our work at Data 2X on COVID-19, we're trying to address these gaps by evaluating what gender data is available, where key gaps remain, and what actions can be taken to fill these discrepancies and ensure that data is used to inform evidence-based response and recovery efforts. I'm so excited to talk today with today's speakers and learn about the outstanding work that their organizations are doing to respond to this unprecedented crisis. They will dive into the issue of data use for COVID-19 and share the perspective from the media, from UN agencies, from local and national governments, and civil society. We'll have two sets of panelists and what I hope will be a very vibrant Q&A section at the end. But that really, of course, counts on you and your participation. So please leave your questions in the chat window throughout the session, and we'll come back to those with our full panel at the end of the session. My hope is that this conversation sets the scene for a vibrant, engaging discussions throughout the forum over the next few days. We are all of us pragmatists with an enthusiasm for information that leads to real change. Given the state of the world these days, having a group of people committed to evidence and acting on evidence is timely, exciting, and important. So let's get to it. I'm very pleased to introduce our first speaker, Tim Harford. Tim is the author of How to Make the World Add Up. It's also going to be known as The Data Detective. He's a columnist for the Financial Times. He's presenter of the BBC radio show, More or Less. If you haven't listened to it, do more of listening to that show, and is an honorary fellow of the Royal Statistical Society. Tim, I'll turn it over to you.
Oh, well, thank you so much, Emily, and greetings to everyone from Oxford. I wanted to start by getting straight into a practical issue, which is the question of where babies come from. Now, a number of you may already have particular theory about where babies come from. And I can assure you that statistics have been deployed to answer this question. And it's really very simple. Babies come from storks, which was what I was always taught. I've got 3 younger sisters, and I used to ask my parents where they came from, and my parents told me, oh, the stork comes, and the stork has a blanket hanging from its beak, and there's a baby in the blanket, and that's where your baby sisters came from. And fortunately, the statistics back this up. So if you simply plot a graph of the number of births in countries around the world and the estimated breeding population of storks, you'll find a striking correlation. Countries with more storks also have more babies. So, and you want to run a standard statistical test, find out the p-value, for example, you'll find it's extremely low. There's no way that this is a coincidence. Storks definitely do deliver babies. Now, at this point, you may be wondering how the trick is done, or you may have figured it out. Basically, small countries don't have a lot of room for babies and don't have a lot of room for storks. Countries which are very large have lots of room for babies and lots of room for storks. It's really that simple. Now, if you have, like I did, if you have read this book, How to Lie with Statistics, by Darrell Huff, I read this book when I was a teenager, you would have encountered the storks and babies explanation. You would have encountered many other examples of statistics being used to mislead. And Darrell Huff, in his book, he's a journalist writing about statistics in a very funny way. In his book, he says that honest folk need to learn these tricks in self-defense because the criminals already know how to lie with statistics. And it's a funny book. It's a good book. It's reported to be the best-selling book about statistics ever published. The more I think about the book and what that book represents, the more uncomfortable I become. Because when you think about it, isn't it strange that the most popular book about statistics is all about deceit, is all about how statistics are used to lie? Would we be pleased with a review of English literature, or indeed the literature of any other language on the planet, that focused purely on how that language was used to tell lies? It seems a little strange. And I realize people like this because it reassures them. Everyday people who have no particular statistical expertise feel a little uncertain. They fear they may be being lied to. And so a book that tells them how the lies are done feels almost reassuring. And of course, for geeks like me, who are constantly trying to use statistics to communicate, statistics can be a little dry, can be a little complicated, technical. What better way to introduce people to the idea of statistics than with a funny story about how a statistic is being used badly, how somebody's made a mistake, or catching out a liar at his or her tricks. But I've started to realize that maybe that isn't really the right way to go about things. If I think about when How to Lie with Statistics was published, it was 1954. And another thing that happened in 1954 is that 2 epidemiologists, actually based where I live here in Oxford in the UK, Austin Bradford Hill and Richard Doll, used statistics to publish some of the first compelling evidence that smoking cigarettes can give you lung cancer. This is a very different view of statistics from Darrell Huff's. You've got this one view that says it's all a joke, it's all a trick. Don't ever believe a statistic. Don't ever let somebody pull the wool over your eyes. And in the same year, you've got these 2 heroic epidemiologists finding out this absolutely life or death answer to a critical question about this enormous health risk that cigarettes are posing. So these 2 different visions, are statistics a tool or are they a trick? I'm sure everyone listening here will say, yes, statistics are a tool, but we need to be careful in the way that we communicate them. We need to be careful in what we say about statistics, because it's very easy to switch into that other mode of communication that says that basically statistics are a trick. And you can see this in the history of how the cigarette companies responded to the threat of the emerging science on the health risks of cigarettes. they immediately tried to persuade people that maybe you couldn't trust the evidence, maybe you couldn't trust the science. It was all very confusing. It was complicated. Scientists disagree. More research is needed. And of course, we've seen the same approach dealing with climate science. And increasingly, we see it even in the middle of this pandemic. People who have a political view of the pandemic, stressing the fact that scientists don't agree, stressing the fact that the statistics are complicated, which of course they are, because that's the way life is. That takes us to a very dark place, because one of the striking things that happened in the whole discussion over statistics and cigarettes is in 1965, the US Senate held a hearing with lots of experts invited to come and give their testimony. And the question was, should health warnings be put on packets of cigarettes? And one of the experts who came to testify reassured the senators that they shouldn't pay too much attention to all of these frightening correlations between cigarettes and lung cancer, because, you can find correlations anywhere once you start to torture the statistics. In fact, you can even find a correlation between storks and babies. And the chair of the Senate committee said, do you really mean to tell me that there's as casual a relationship between cigarettes and lung cancer as there is between storks and babies? And the expert witness said, the two seem to me to be about the same. His name? Darrell Huff, the author of How to Lie with Statistics, this nerd hero, this lovely little book that teaches us how to think clearly about statistics. Maybe it doesn't teach us the right lessons at all. I don't need to tell anybody how vital statistics are. But what I am saying is we need to remember our continual importance of emphasizing the usefulness of statistics, the importance of honesty and transparency in statisticians, and the fact that without good statistics, we really can't make any sense of the world at all. Statistics can be used to lie. Statistics can be used to play kinds of tricks and jokes. But if we get too distracted by the tricks and the jokes, if we focus too much on debunking the lies, then we start to lose track of the fact that statistics can also show us what's true. And the rest of the panel have been doing amazing work in using statistics to tell us the truth about the world. And that's why I'm fascinated to hear what they all have to say. But I've said enough, so I'll shut up. And thank you very much.
Tim, thank you so much for that, and the range from storks to cancer to climate change, and I think most importantly, just this reminder that we should be suspicious when we're told that something's too complicated for us to understand. I think that's such an opportunity for our World Data Forum community, is to say that statisticians and data are not only for people who are statisticians and data scientists. It's really for all of us. So thank you for that message, and I look forward to coming back to you in the Q&A. So you maybe have to get some baby and stork prepared for that. Now I'm very pleased to turn to David Nabarro. David is one of the WHO Director General's special envoys on COVID-19 preparedness and response. He provides strategic advice and high-level political advocacy to help the WHO coordinate the global response to the pandemic. He's also co-director of the Imperial College Institute of Global Health Innovation at the Imperial College of London and strategic director of 4SD. David, I'm going to turn to you to hear about the use of data in the WHO's COVID-19 response. Thank you.
Emily, thank you. To Tim Harford, calling in from Oxford, thank you. I'm got the honor to be in this really important meeting from Geneva in Switzerland, where I'm based. I've been working in the health of populations, or public health, for 45 years, starting out as a doctor, working in wars and in really quite tricky circumstances. beyond looking after individuals who were ill to looking after communities and then societies. And perhaps I should therefore start by saying to all of you, I am utterly committed to finding useful and reliable data to help me and my colleagues make decisions that are the best that we can possibly do for large numbers of people. And that's why from the earliest stages of my medical training, I got really interested in measuring, and sometimes super frustrated because the measurements that I had and the numbers that I had did not give me the kind of information I needed to make the decisions I had to. So I've been interested in data as a medical practitioner and more recently as a public health practitioner all of my life. I'm going to now share with you some of my own views about the significance of data in the context of the discussions today. I will be quite tight in terms of what I'm going to say because we are restricted on the amount of time that we have. But I would like by the end of my remarks for you to share with me a sense that to have data is really important for decision making, but to have the environment within which it's possible to share data is even more important. It's the context that matters as well as the numbers themselves. And I'll try to explain why I mean that in the coming few minutes. Imagine you're me, okay? I'm a medical doctor trying to help make sense of what this pandemic is doing to people, to their communities, to their nations, and indeed to the world. And so I have to have numbers. Without numbers, I can't form a pattern in my mind. And without a pattern, I cannot easily explain what's going on. A very senior person wrote to me just a few hours ago and said, David, what do you believe is the trajectory of this pandemic right now? In particular, what's the trajectory among people in Europe? I've replied, and I will try towards the end to explain how I replied, but I couldn't have replied if I didn't have access to data. And in fact, I went back and I looked at the WHO worldwide situation reports, together with some extra material on what's happening in a number of countries that I'm following in detail. And I felt, okay, I do have, at least as far as I'm concerned, a reasonable view about the pattern. I'm asking very simple questions. Who's affected? Where are they? When are they most at risk? How are they affected? All those kind of simple question words that you often have when you're trying to understand what a pattern is. And they're deceptively simple. Okay, David, who is affected? Well, I can tell you that we've got nearly 40 million people reported as having COVID in our world since the thing started in January. But no, sorry, I want to know really who is affected. Is it all the people in a society, or is it just the people living in dense urban areas? Is it all the people in the dense urban areas, or is it more likely to be the poorer people in the urban areas? Can I get a breakdown that tells me a little bit more about their wealth? Is it more men than women? Can I have a sex breakdown, please? Is it people who are living sort of close to health centres and perhaps are connected to health personnel who are more at risk? Or is it people who are working in food factories Or is it people who perhaps are connected with detention centres and prisons? Don't know. Haven't got the information. And that's when things get difficult. I'm asking my who questions, but the data don't help me answer them. Where are they? Are they in the slum areas, or are they all over? Are they in densely concentrated settlements, or are they in the settlements that are more widely spread? And are they getting ill quickly after they've been exposed to others? And are they on the lists of the contacts of people who've already had the disease? And how quickly are they getting medical attention if they're really ill? I'm going more and more with my questions into more and more detail, and I'm interrogating the data. And then my colleagues look at me and say, David, you're right to be asking these questions, but we don't have the answers. That's because as we get into more and more detail, so the data that we need are more and more sensitive. They're sensitive partly because they get close to a point where you can start identifying people and even stigmatizing them. Or they're sensitive because the more you get into them, the more embarrassing they are for the authorities who don't necessarily want detailed, disaggregated information made available publicly. And so, as a person who's responsible for advising on responding to this series of disease outbreaks around our world, I need data so much. And I need these data to explain to me enough so that I can build up patterns. And I need these patterns to be available over time so that I can look at the past and try to make some projections to the future. But the more the detail I get to help me make really good patterns, the more I'm running into issues to do with personal privacy, as well as to do with the privacy of the organizations, even the governments with whom I'm working. Is there a solution? Well, yes, there is. You are helped greatly in this kind of work if there are networks available in which people can come together and share preliminary data and do it confidentially and not be worried that their information is going to be taken and spread all over the place and used to discredit them. There has to be an element of confidentiality and trust around the kind of data that are useful for management decision-making. And that sense of trust and confidentiality is key, because when individuals are sharing these preliminary data, they have to be protected. Otherwise, they get attacked, and they can get attacked so very badly to the point where they lose their jobs. And it's that question of how it's possible to create networks of trust, honesty, and openness where individuals are protected that is key for dealing with this kind of issue. If that trust, honesty, and openness is not there, then it's really hard for us to work together and deal with an emerging problem. Now, the World Health Organization was created as a body in which professionals are able to come together and work in a degree of confidentiality, sharing their opinions, sharing preliminary data, sharing potential conclusions without worrying that they're going to get bad-mouthed, if that's an okay word, in social media or in other avenues. It's a great creation, the World Health Organization, And I'm very keen to encourage WHO and others to do more of this creation of reasonable working environments. Then we can go on developing and exchanging data in ways that help us to form patterns and make conclusions. Thank you very much, colleagues.
David, thank you so much for those comments and the reminders that we're not only in a quest for more data and the data we need to build patterns, but that there are real concerns and complications as well with that data in terms of thinking about privacy and confidentiality, as well as protection for those who are working with data and working so hard every day to help us chart our way through this and beyond this pandemic. So thank you for that. I am very pleased to introduce our next speaker, Jean Holm. It is truly the middle of the night for Jean. She's coming to us from Los Angeles, where she is the Chief Data Officer and Senior Technology Advisor to the Mayor at the City of Los Angeles. In this role, she helps 4 million people and 500,000 businesses get access to and use data for innovation, equity, health, and safety. She connects public and private partners, and she founded the Data Science Federation, which partners with universities and cities to create innovative solutions, such as using AI for traffic safety and machine learning to improve air quality. Jean, I want to turn to you to hear what you can tell us about the use of data at the city level. We've heard a lot about the global level so far. So what can you tell us about the use of data at the city level for effective COVID-19 response?
Well, thanks, Emily. And just hello to everybody from Los Angeles, California in the United States. And really happy to be part of this discussion at the UN World Data Forum. Thank you to the work that Tim and David both mentioned and the amazing work that the World Health Organization is doing. The role of cities is slightly different. The role of cities is David, to actually know the answers to all of those questions that you asked, because we are sort of the line of information, the last line of information before it gets to the consumer, in this case, our residents and businesses, in a way that actually, can be implemented in one way or another. So the information that we pull together around COVID, the case fatality spread, the vulnerability, all of that gets fed to the mayor and other elected officials here in Los Angeles. And that then leads to decisions about the opening or closing of businesses, when restaurants can have sidewalk service versus in-place service, when schools can open and close. And as we know, things change very differently across the world, and certainly very differently even within the United States. I am fortunate to live in the state of California, where our state and county and city officials are very much synced up with making sure that we are approaching COVID in the most safe possible way, even with all of the other issues at play there. For us, part of that is gathering data in a way that respects people's privacy, but also holds some accountability in place to have transparency to that data. So, for example, we trace the number of cases of outbreaks at nursing homes and convalescent homes and group living spaces specifically, and we publish that data openly for people. And the same thing is true for businesses where there are outbreaks. So particularly, there's some vulnerability around close-packed manufacturing businesses when there's not enough precautions taken place. And again, we publish that transparently and openly, not just so that we have that information to be able to go in and do investigations and audits of those businesses, but also so that people have that information. And then I think an important piece that maybe we haven't talked, maybe Tim alluded to this a little bit, is the ability to communicate this in a way that helps people have more effective actions. Right. So we're trying to make sure that people understand why it's important to wear masks, understand why it's important to do social distancing, and understand why it's important to, as much as possible, avoid physical connections with other people. But it always comes down to the individual making that choice and feeling compelled to it, whether it's, understanding where babies come from or understanding the risks of smoking cigarettes, in this case, the spread of COVID. So we have a big focus right now around data literacy and communications. So we communicate information about COVID, yes, on dashboards, and yes, with open data sets, with APIs, but more importantly, on television. The mayor gets on television almost every night with a press conference to compel people to understand what the risks are and what needs to be changed. In Los Angeles, we speak 220 languages. And so we push that information out on social media and through a call center to make sure people have access to all that information and a place to call. The mayor is trilingual, which is great because it helps to be able to communicate that information in a sincere and open way. Again, the idea that we have data that helps to drive forward the changes we're going to make in policy, the changes we're going to make in order to be able to have effective interventions is important, but it's just as important to compel people and help them understand what the data is saying and why it's important for them to have safe behaviors. And so as part of that, we really have a much broader view of who is helpful in collecting that data and who is helpful in communicating the data and analyzing it. So I'm just going to highlight two very specific projects we did. One was a COVID computational challenge. So we did a global challenge around understanding if there's a place-based risk related to the spread of COVID. And we had over 400 participants from 4 continents around the world come together to understand issues around the effect of having more traffic and more mobility data, the effect of case fatality rates, of spread, of poverty, of socioeconomic status, gender, ethnicity. We put all of this data together and let people run different models against it. And what became clear very early on was that there were definitely issues around equity. And so when we think about everybody having the same risk of having COVID, that's just not true. David was alluding to this earlier. We know that people who are elderly, we know that people who are in dense urban populations and high population density are more prone to it. And we also know, unfortunately, that people who are Black and brown and people who are poor also tend to have a higher transmission rate, because often those people are put in a situation where they have to physically go to a job or physically go onto more dense public transportation. And so when we started to look at that and look at the risks, we were able to then make specific local decisions like, we need to have more testing centers in different communities. Instead of having just drive-up testing centers, we needed to have walk-up testing centers. And we needed to get those test results back faster to people. So Los Angeles was the first city to provide free testing to anybody with symptomatic or asymptomatic. So anybody could come in from almost the beginning of the pandemic and get free testing. Kind of information that, when we pull it together from a statistical perspective, helps to give our public health officials and our elected officials and the Mayor Eric Garcetti the information they need to make better decisions and to help make sure that we're doing what we can from a city to connect that and organize that. And the second one is really being able to convey it in a way that helps people to make better decisions. And finally, to bring together a global audience of people with different perspectives. Our Data Science Federation brings 18 universities of professors and students to help us understand these problems every day. Our Data Angels bring volunteers who are mid-career data science professionals to do that. And all of this puts it together in a way that gives us a better view across the effect of COVID on different ethnicities and different genders. And just as you mentioned earlier, Emily, we also understand that the issue is not equitable across gender, that the effect of COVID, both specifically, but also the longer term effect of how it's happening disproportionately for women is also being understood better. And the amount of women that are dropping out of the workforce, as we've had an extended time where we have to accommodate childcare and family issues, is also, a huge impact. So I just want to thank everybody for all the work that they're doing. The work that you're doing comes down to a city level where we're trying to make sure that people, as they go about their daily business, understand the risks, that it's communicated to them, that our policies and practices are keeping people as safe as possible, even with all the stresses of trying to keep economies as open as possible while keeping people as safe as possible. And I think that ability for any city and any local government is essential to understanding how to be as equitable as possible.
Jeannie, thank you so much for that just really passionate, I think, call for us to be thinking about the way that we're communicating across different communities. I thought that was a really powerful point. And if I may, I'll just take 2 minutes before we move on to the next segment of our panel to try to summarize some of what I think we've been hearing so far. So Tim, we all remember about the babies and the storks. That's the same story I heard. But more importantly, he made a really, I think, timely point about how there's really often two different versions of statistics. And I think we've heard this from both colleagues, David and Jean, as well. There's one vision that yields skepticism about statistics with a heavy focus on the dangers of misinformation. And the other is a trust in the work that statisticians do and a responsibility for statisticians to trust their audience and for the audience to also work with statisticians and work to understand and work to act on that information. And I think, one of the questions that I felt like your talk posed, Tim, was, do we focus on the misinformation or do we focus on the positive side? Do we focus on, listening to information and acting upon it? And I think this is just great fodder for not just for this panel, but as as this whole community moves through the World Data Forum this year. David, just want to say on behalf of all of us watching, just a very heartfelt thank you to you and all of your colleagues at the WHO, who I know are working tirelessly on this pandemic, on helping us get through this really urgent and scary time. So thank you for that. And thank you for your leadership and commentary on how necessary data is for that, for us to do that. If we're going to emerge out of this time, it's going to require having those patterns and identifying those patterns and using them to weather this storm. So thank you for those comments. Jean, I think one of the things I really loved about hearing your talk was not only taking it to the city level, which I think is so helpful. We all live within cities, we all live within communities, right? We're asking ourselves every day these questions. I mean, it really hit home to me. One of the points you made about women in the workforce, even I acknowledge my position of privilege, but with 2 young kids, I have asked myself, like, how do I keep doing this? Maybe I should take a break, which I'm not going to, I'm not leaving, but these are the questions that so many working parents are asking themselves every day. And I think it's important for us to ground ourselves in those realities. And I think you also really highlighted that piece, this human piece, that part of this is about communicating what are the effective actions that need to be taken, and really the power that communications has, in this case, to know the audience that we're speaking with and to see them as a part of, to see all of us as really a part of the solution, right? Rather than, oh, here's a bunch of charts and numbers and, it's the decision makers who are making all those decisions. Yes, the decision makers need to be responsible and make those decisions, but so do citizens and communities, and they need to be able to understand and act upon those numbers as well. So thank you so much for that. And thank you to this first panel. They're not going anywhere. They will join us in the Q&A at the end. But now I'm very happy to turn to a short video, which features the SDG advocate, Ms. Hindu Umaru Ibrahim, who is an environmental activist and the UN Secretary General's advocate for the SDGs.
Dear all, thank you for the invitation to exchange on this important issue on the role of data and technology to fight global crisis. As Sustainable Development Goal advocate, I would like to stress the urgent need to use data to achieve the 2030 agenda. Today, data are used as a basic product by private company and government for a lot of purpose, but it is still unclear to me if data are really used to serve the public good. With the SDGs, we have a global agenda to eradicate poverty, reduce inequality, and protect our planet and its unique ecosystems. Climate change is already devastating our home in the Sahel, tropical forests and ice cap, while data are used in industrialized fishing and agriculture to accelerate deforestation and biodiversity loss. It is time to use data to understand and combat all pollution, to develop health services in the poorest communities, to accelerate the deployment of clean transport and sustainable energy that can make a difference to reduce inequality. As Indigenous woman, I am also used to say that there is an Indigenous traditional knowledge, an important and unique reservoir of data of knowledge that are very precious for our ecosystems. Living in harmony with Mother Earth since centuries, we have accumulated a lot of knowledge about our savannas, desert, forest, coral reef, or the ice cap. It is more than what artificial intelligence or that machinery learn will never do. Any smartphone or a computer will never replace the wisdom of our elders. If we put our different knowledge system in partnership, we can build and serve our planet and peoples. I do believe that if data experts learn to work together with planet protector, we can make a huge contribution to the Sustainable Development Goal achievement.
Well, a virtual thank you to Ms. Ibrahim for sharing that video with us and for reminding us about really the information also that communities have in knowing how to come together to solve problems and to use data to do so. I'm very pleased right now to turn to our next speaker, Beth Blower. Beth is the Executive Director and co-founder of the Centers for Civic Impact at Johns Hopkins University. She's a dedicated public servant and international expert on government performance programs and brings her experience as a leader in data-driven insights for city leaders and public sector practitioners across the country and around the world. Beth, I'm going to turn to you to see if you can tell us about your recent experiences putting together COVID-19 data and dashboards, which have been critical for all of us in understanding the pandemic.
Yes, thank you, Emily, so much for having me. Thank you to the UN World Data Forum for bringing together was such a formidable first panel of the morning. I feel completely out of my league amongst these panelists, so thanks so much for having me. I'm going to talk this morning a little bit about the work that I've been helping to lead here at Johns Hopkins University on the Coronavirus Resource Center. And if we can go to the next slide. I think many of you have seen this map before. This is the map that we started, which actually started in our engineering department here on campus. It was an entrepreneurial grad student and his supervising faculty member in the engineering department who had been doing tracking of other disease. And this particular grad student had family in Wuhan, China, and was trying to really understand the very early outbreak of the COVID-19 virus and decided to start mapping it as they had mapped other disease in the global landscape. It started really just leaning in on public, openly available data, and it has then grown. And as the disease was progressing, we started to really understand that yes, indeed, it was coming to the United States. And for me, working with cities and with city leaders and with people like Jean and others that were trying to really effectuate policy change and decision making, we knew we needed to go a bit deeper here in the United States to think about the role that data was playing as we were thinking about the spread of disease. And so if you go to the next slide, you can see that we really started to sort of dig deeper on what is the local impact of the disease. And when we started thinking about that data from the context of the US, we really started to understand that not only was it really critically important for us to collect disease data, but we really needed to understand the impact the disease was having on our community. And so we started to think about the data in three sort of different independent components. The first one was we wanted to really understand what was the data telling us about our readiness to respond to disease, and what does our public health data, our public health writ large infrastructure look like? What we were seeing was that our public health infrastructure, our hospitals, our emergency rooms, our ICUs, our intensive care units, our ability to have the right kind of PPE for our frontline healthcare workers was wildly under-invested in even prior to the spread of a global pandemic. And so when we have these stressors or these shocks to our health systems, the data was very clearly telling us that we needed to think differently about our health infrastructure. And are we going to use this moment where we understand this data as a catalyst for us to think differently about how we not only approach our public health challenges, but just how we think about our infrastructure, where we invest in our infrastructure, and how people access healthcare? That's not just a lesson that's being felt or learned here in the United States, but it's also something that we're seeing globally, where we had sort of done the minimum amount of work to be able to respond to health needs. But when we are having such an incredible stress on the system, the data is really telling us that we need to think differently about how we resource. The other big piece that we started to look at was something that we've heard from all of our speakers, which is the demographic breakdown of the data itself, without really understanding fundamentally not only who the disease affects, but where it's what's leading to the outbreaks, where are the sort of communities that are going to be most disproportionately impacted by the disease. Without having that data as broken down in significant ways, it makes it really difficult for public health responders to get messaging out. So when we talk about genes, communication, without that underlying data, without being able to have those sort of baselines and understanding where there's populations that are going to be most at risk, you really can't effectuate the right kinds of communications. You can't really think about the right strategies without really having all that information at your disposal. And then the last piece of this is that there are no standards for how to measure COVID-19. This was something that came out of nowhere. There was no international data standard. There wasn't any kind of consistency in the way that we thought about how we counted who has the disease, how the disease is spreading, what does it look like to have enough testing in your particular community? Are those tests being used effectively to actually understand the spread of the disease? None of that was really standardized, and still really is not really standardized. We leaned very hard on the WHO, who did a great job at providing early guidance early on to help us understand what the role of positivity should have in the evaluation of the disease, but certainly not being led anywhere nationally here in this country. And I think many other countries are grappling with this, is how do we create a common language around this disease so we can not only talk about the right interventions, but also talk about the impacts, what is working, what isn't working. And with the lack of those standards and with the lack of that kind of common language, it becomes very difficult to respond. And so we see varying impacts. So if you go to the next slide, you can see that we are still very much in the middle of a global pandemic that's having disproportionate impacts globally on many different places and at different levels. And so at JHE, what we're trying to do is continuously create that kind of common language so that you're seeing the same kinds of visualizations, that the data is aligning in the same way so that you can really think about the impact. Next slide. And if you drill deeper in, you can see that countries are responding in different ways. They're using different strategies. And if you use the data, you can actually figure out which of those countries that you should be leaning on, which you should be looking at as an example, both from what is working, what is not working. And the data really does help you understand that in significant ways. And then the policy decision-making aligns quite neatly with the data itself. I would be remiss if I didn't really talk about the moment that public data is having here in this pandemic. And I've worked my entire career on trying to get people to appreciate the use of public data, to use public data to align to decision making, and to really value the use of public data. And I think this is a moment that has dramatically changed the way that we think about public data and the way that we're going to be using data. This has been an equalizing event. People like my parents and my community have been logging on to see what the disease looks like in their community, whether or not they're going to wear PPE, whether they're going to go to the grocery store today. It's influencing our individual decisions. Governments around the world have data that has been trying to lead behavior, trying to change people's way when we think about global warming, when we think about the way that we're trying to get more people to use public transportation, when we think about trying to end some of the most important challenges that our communities face. there is lots of very rich, important data that we have in the landscape of the work that we do that should be influencing our decisions the same way that we think about the COVID-19 data influencing our individual decisions. So my challenge for this group as they think about the next few days is how can we use this moment, this incredibly important moment for public data as that catalyst for change, as we think about the ways that we integrate more and more of this important baseline, this important data to influence decisions so that we can ensure better outcomes for all people. Thanks very much.
Thank you, Beth, for that, and agree with echoing that cry of how do we use this moment that we have for public data and the attention and this opportunity that it provides to not take for granted. You were talking about health infrastructure, right? But I also think that, you know, data infrastructure goes along with that, and we have to invest in that. We're taking a lot for granted about what exists and what doesn't exist. So thank you so much for that. I'm really pleased to introduce our final speaker, a friend of mine, Mercy Kanyuka. Mercy is, oh, there she is. Great. Hi, Mercy. Mercy is a seasoned statistician with over 30 years of experience. She currently heads the National Statistical Office of Malawi and has served in senior management and strategic leadership positions for the last 20 years. So, Mercy, my friend, can you tell us more about the role of the National Statistical Office in particular in coordinating the data response for COVID-19?
Thank you very much. Good afternoon from Malawi, the home heart of Africa. It's an honor, honestly, to be here and be amongst these great panelists. And just say a few remarks. The National Statistical Office, Malawi, another statistical office has been hit hard by COVID-19. That's a fact. We do rely in physical, face-to-face data collection, and that has not been possible. It had to be curtailed. For example, in Malawi, we had to stop midway when we were already in the field, when we were all called back, and we had to, as soon as there was a case, a COVID case in Malawi, there was a complete with intervention from we had to seek intervention from the authorities to continue with our data collection activities. The only remaining data collection activity which we were allowed to undertake was price survey data collection for inflation rate and so on. But we had to curtail very, very important data collection activities such as mix, as well as living standard measurement. But after 3 months, we were allowed to go back to the field. But that had additional cost because then we had to take care of precautionary measures, provide face masks to the data collection team. Not only the data collection team, but we also had to provide face masks even to the respondents. Malawi is a poor country, obviously, not everyone can afford a face mask. So we also had to we also have to provide face masks to even the poor respondents out there. So overall, NSO Malawi is still collecting data through different projects, but we're ensuring that our enumerators are following COVID-19 measures, such as wearing masks, social distancing, and so on. But on the role of National Statistical Office, to the crux of what I'm supposed to indicate. One, we are continuing to collect data to monitor impact. At the same time, we are also providing supervisory role in Ministry of Health. To the way National Statistical Office Malawi operates is that we've got statistics units in ministries, and those statistics units report to they're actually seconded, they're under National Statistical Office. So because we have our team members there, we have statisticians in the ministry, they are providing statistics, the required data, and we are providing that supervisory role. The National Statistical Office also is using, is providing the necessary data for COVID-19 interventions. There are some interventions because people, different households have been impacted differently. So there are measures that government would like to compensate or at least to give them some subsidies. That information is coming from National Statistical Office to be able to target the various interventions which government as well as the development partners are using, are providing to cushion the impact of COVID-19 on the poor households in the rural areas, but even in the urban, peri-urban areas. The National Statistical Office is also providing sampling frames. There are a lot of researchers, and especially the seasoned, well-established research institutions are coming to National Statistical Office to get samples, sampling frames. Some of them, quite a number, have actually even requested National Statistical Office to provide a sampling frame to even help them in the sampling design of their surveys. I have a few examples where the Center for Social Research is collaborating with the National Statistical Office to carry out studies which are looking at impact of socio-economic impact of where we are also conducting, looking at the impact of COVID-19. So in addition to NSO just providing carrying out various studies, we are also coordinating the research institutions which are government or semi-government institutions carrying out studies. I think I will leave it there, although I have got some few challenges which I would like to indicate. We have had to redesign our surveys. Some of the surveys we are using phone calls, but not everyone has a phone in Malawi. Therefore, it's bringing in some kind of a bias because we have to go to households which have got phones already. That's a bias. But we also have got some partners, especially private sector, industry surveys. We are using emails, addresses, and so on, and it's not as ideal as it is when we go out and carry out these face-to-face interviews are always the best, but it's quite a challenge to redesign these surveys and make them as effective as possible. I think I'll leave it there. Thank you very much for the time. I know at the time we are now getting limited time, but that's all I have to say at the beginning. Thank you very much.
Mercy, thank you so much for that, and I think also highlighting, and pulling back the covers on how this works with national statistical offices. Not only the work that you have to do in producing this information, but also really working with ministries across your government in order to ensure an effective response. So thank you for that. I know that we are starting to draw down on time, and we promised a Q&A, and there have been some questions coming into the chat, so I'm actually going to turn straight to those for just as an FYI for the panelists, and thank you to WhatsApp for making this easier. So my first question, the first question that's not my question, but is from one of our audience members, is for Tim. And the question is, what do you think is the best approach to minimize the risk of lay people being misled by statistics? So in the context of statistics used in a bad faith manner.
I think it's a great question. There's no simple answer. But from the point of view of the individual concerned, I think we all need to be more curious about the world. When we're trying to use statistics to bolster one side in a political battle, when we're trying to win an argument with statistics, that's just making us dumber. And when we're curious and we're trying to understand what's going on and we're open-minded, it makes us smarter. And so there's even some very interesting research coming out of Yale that suggests that people with a curious mindset are less subject to political tribalism and politically motivated reasoning. Because while most of us, when they see something from the other side of a political debate, we try and shut it off. We don't want to listen. Curious person is like, oh, I didn't expect that. That's interesting. So they ask more. And the flip side of that, of course, is from the point of view of statistical communicators in the media, in official statistical associations and elsewhere, we should really try to awaken people's curiosity. So rather than simply be in simple sort of debunking mode, oh, that's not true, that's not true, that's not true, or reporting in a very dry way, here are the data and we don't need to know more. If we can interest people in big questions about the world. I mean, almost the first thing David said in his remarks was to start talking about questions that he had and he wanted answers to. And some of those questions he had the answers to, and some of the questions he didn't have the answers to. Immediately, you start thinking about that. You start thinking about who's missing and who's affected. That can be very effective. So focus on curiosity. Focus on the idea that the world is a fascinating place. It's full of puzzles and mysteries, and the data can help us solve some of those puzzles and mysteries. And as long as Orson Welles said, if people are interested, they will understand anything, no matter how complicated. If they're interested, they'll figure it out.
Thank you, Tim. A cry for our curiosity and lifelong learning. Appreciate that. So this next question, I'm going to turn it to Beth. So Beth, it says here, we can engage the public through citizen science to provide the data we need if we give them information back to help them manage risks in their everyday life. How do we build on the growing understanding citizens have on the value of data and engage them in gathering the data we need through the development of common global citizen science systems? And how do we fund this work? A small question.
Small question.
All of these are very small questions, by the way.
Well, I think, the more that we make the data relatable so that it actually has deep connections to the lived experience, to the experience of delivering frontline services, to the experience of really trying to solve complex problems at the most local levels, that's where you really get the buy-in. I find that when you extrapolate and you create really high level views, people can really disassociate from data and from that experience because they don't see themselves reflected in the information. And so I think one of the things that one of the big mistakes that we often make as big public data thinkers is we don't take in that frontline or that lived experience, and that we don't reflect it very intentionally in the work that we do. So the more of that reflection, I think, is better. And then I think in terms of like, how do we create infrastructure and systems that cut across countries that are global, it really does start with governance, and we are greatly lacking in the kind of governance that we need in order to drive forward this common language, this common infrastructure to start thinking about, and that requires there to be some trade-off conversations that requires us to think about where in the world we're having the most difficulty building out infrastructure and thinking about the capacity of data and making sure that we're allocating the right energy and the right resources to the places that need it the most. And I think that for as we think about funding that, we know that there's a lot of philanthropic interest in data infrastructure. Certainly in the United States, we know that we have a lot of philanthropy that is deeply invested in making sure that cities and states and federal agencies have the data infrastructure so that the best information is getting out. How can we also challenge those same deeply committed data philanthropists to start contributing also at this global level so that we can really have an infrastructure that is widespread, that is easily adoptable, and that is guided by governance that will allow us to navigate these global events with much more grace and acuity.
Well, thank you for your grace and acuity in that answer, and also a call for the kind of investment that's really needed for data systems around the world. I think the figure is something about 1%, around 1% of ODA, Paris 21 reports, is going to development data. And yet it is absolutely critical for response for so many reasons, and for so many things beyond COVID-19, right? And yet we've really critically underfunded that infrastructure. So thank you, Beth. I'm going to turn to Jean with a question next. So the question from our audience is, do the citizens trust the data that we generate for use? Do our analyses, interpretations, and generalization make sense to the populations for which this data and analyses are intended for? What are your experiences?
It's a great question. And one, as somebody living in the United States right now, I sort of feel that pain every day. The challenge, I think, is taking a political view on data versus, it's kind of back to what Tim was saying. You know, you can have the data say whatever you want if you're trying to defend a certain perspective, and trying to depoliticize the data in the United States particularly, and trying to make it very understandable for people. So not sort of, we do show charts to the public about what the data is, the infection rate, what our PPE is, and that kind of thing. But we also make it available in a conversational way. And I think putting a person, a face in front of it. So again, nightly we have the mayor to be able to talk to people about not only what the data means, but sort of the impact that means and what we're doing about the impact, how we're helping small businesses get better access to loans, how we're changing the rules around restaurants because, and why we're doing that and why it changes over time. And the effect that that this is having on communities and individuals, I think is all really important. Humanizing the data and putting a person in front of it and making it conversational is the way in which we can actually build that trust with government. It becomes so essential to be able to help have that shared experience. People in the United States particularly, you know, they have different opinions about the data. They feel like it's some kind of a belief system, as they feel that science is some kind of a belief system. I think it's really up to each of us to manifest the data in a way that is understandable for them. So the ability for them to approach it and see it in the world around it, going back to what Tim said about curiosity, helping them answer the questions that clearly they're asking themselves, even if they don't say it out loud, helps them to understand, oh, this data is affirming what I start to see in the world around me. So I think it's really just important to pull all of that together. And I just want to mention that the language we've developed amongst us over the years with the Sustainable Development Goals, and LA is a city that has adopted the SDGs as a framework, has helped us, I think, be able to have that global conversation in a way that helps cities and others to be able to share with each other. So the work and the framework we've done through the World Data Forum over the years and the UN, I think really helps to structure that in a way that helps us to structure it for else.
Thank you, Jean, so much for that really thoughtful answer to the question. There's two more questions. Every one of you, when you're answering, I have all these follow-up questions for you. I'm just having to bite my tongue. You're all so wonderful and interesting. Two more questions. One first for Mercy. I'll go to Mercy, and then coming back to you, David. So Mercy, you talked about the interplay between NSOs and ministries, and you talked a bit about the Ministry of Health as well. I'm wondering if you could comment, and this is also a question from the audience, on what are the best approaches to strengthening national statistical systems, and specifically health statistics systems?
Thank you. Thank you very much for that question. Indeed, period, and especially more so now with the COVID-19, that there's a need to strengthen the national statistical system, specifically the Ministry of Health data statistics system. We do have the medical personnel whose is obviously to make sure that people are well, people are treated, patients are treated, and it's an added effort to ask them to be also the people to compile statistics. So there's need to have special people just to be managing the data. And we have seen that has worked in Malawi, where we've posted statistical personnel in the various health centers, as well as major hospitals, to take care of the data requirements, take care of the data efforts. It's not easy, because obviously the health personnel feel that the statisticians do not understand some of the concepts. We are coordinating, and we are working towards perfecting that collaboration, so that we ensure that it's actually the statisticians who are doing the computation of the data. I must mention that the data coming from Ministry of Health on the actual prevalence of the patients and so on is detailed enough, but maybe what we require is on the impact side, so that there's more coordination. It's okay. We are able to coordinate the well-known research institutions, but the private sector, now there's a lot of demand for data on COVID-19, and there has been a booming of whom I would want to call briefcase researchers who are quickly coming up with the data on COVID-19 and so on. But this is information which is questionable. It is questionable because you don't know how they've conducted the samples, but because there's hunger for data, people are just using all this data. So what we need is really to coordinate even the private sector, so that they share with us their methodology, so that we can vet the information. We are available to vet that information. Thank you very much. Thank you.
Thank you, Mercy. And that's actually a perfect segue. It's as if we planned it. It's a perfect segue to the last question, which is for David, which is around this question of coordination and partnership. So, we have a lot of different stakeholders who are on this panel, David. We have, local government, national government, civil society, and media. One group who's not here, but I know is very well represented in the World Data Forum, and Mercy's referred to them a few times in her remarks, is the private sector, right? So we have all of these different stakeholders who are working together and need to be working together. But how could and should they work better? What's needed to make these types of partnerships work better, and how do we make the case for that?
Thank you very much indeed. First of all, to Emily and to everyone else on the panel, this is really fun and shows to me the value of having different kinds of people with very different perspectives on a panel like this. And I'll explain why. I've been working in development issues for a long time. And one thing I've learned, the more I've been involved in it, is that you can get 20 different people sitting in a circle looking at the same set of issues, and each of them will have a very different perspective on what is happening. And these separate perspectives are a reflection of the fact we're dealing with really complex systems. And so somebody who comes from an NGO reflecting the interests of a particular group of citizens will have one perspective. Somebody who comes from a business who's looking at people as consumers will have a different perspective. Somebody who's coming from the Public Health Agency will perhaps have a third perspective. There's somebody who is leading the local council will have yet another perspective, and that's okay. That's okay. Simply because the way in which we select the samples of people from whom we obtain our data and the approaches we use to collect our data, and then the different perspectives we use to analyze the data and then the information we use when interpreting the data will inevitably be different. And I suppose I'm saying, great. What we need to do is to crowd in the multiple perspectives and to accept that as a reality in systems working. In the end, what we're doing is trying to collect bundles of information that give us general evidence as to where we're moving, the patterns I referred to at the beginning. And I will keep coming back to the absolute importance of trust among all the people who are involved so that people can explore with each other what they feel are the strengths, the weaknesses, the limitations, and the potential of what they've got. So anyway, that's just my view, and I'm going to continue to invite the World Data Forum to work in this way, to bring different groups of actors together so that we can actually benefit from the richness of our separate curiosities, going back to Tim's point, when we try to make sense of what's happening in a particular situation. A beautiful panel. Thank you.
David, I think that's a great way to sum it up. A beautiful panel. I'll take it. I'll say thank you. We need every win we can get. And I am very sad to have to end this incredible conversation with Mercy and Beth and Jean and David and Tim. It's been really wonderful. Thank you so much to the World Data Forum organizers for bringing us all together. I feel like I have new friends. And I'm just so glad that we had this opportunity to talk about the importance of partnership, of trust, of collaboration, of communication, and of not forgetting the reason that we're doing this in the first place, which is to use information to help all of us weather this pandemic and to come back from it hopefully stronger than before. So thank you to our panelists, thank you to the organizers, and thank you to all of you who are listening in. Let's keep the conversation and the action going. Thank you so much.
New friends, I love it. Bye-bye. Thank you.
Bye. Thank you all.